the studio is Dave White. He is with the Ohio Project, actually the Lucas County coordinator, and this is a movement to allow Ohio citizens to opt out of the federal health care plan. Now, we've heard about other movements in other states to opt out of federal health care reform, but what's different about Ohio?
The difference with Ohio is the other states, their attorney generals and the secretaries of states are taking this action. Ohio refuses to take the action, so we citizens must do this petition initiative and get it on the ballot.
Okay. Now, this is the very shorthand version of what you're doing. The proposed constitutional amendment would simply give each Ohioan the freedom to opt out of the new federally mandated health care system. So what you are wanting to do is not say, okay, Ohio is not going to be part of the whole federal system, but this is an individual rights issue? Exactly.
It's for Ohioans to be able to not be subject to a mandated health care. If you do not want to purchase it, Ohioans will not have to if this passes. If you want it, you can go ahead and purchase it.
Is being forced to purchase health care insurance the thing that has triggered the movement? Is that what makes people angry?
Yes, the freedom of choice, the lack of freedom of choice.
Okay, then how does that improve the situation of people who are currently uninsured and being paid for by all taxpayers? What's the answer to that?
Those programs are not going to be changed. Nothing will be affected by that. All we are doing is saying that the bill that was passed in Congress a couple of months ago, the Ohioans will not be forced to abide by those stipulations, the fines, the regulations, the purchase of the insurance, all that.
Okay.
If you want to have the insurance, you can go ahead and avail yourself of it any way you want to.
All right. Now, what's the procedure you all are going through in order to get this to Columbus? What do you need at this point? Is it a signature campaign?
Yes, it's a signature campaign. We have petitions. They are very specific. They're 8 pages, 30 names per petition, and they can be downloaded off the internet from theohioproject.com, but you must watch training videos and you must follow the procedures so that they will not be thrown out or disallowed. There are very specific rules and regulations on the petition. We advise people to come out to one of our signing events and get some training before you start circulating petitions if you want to be a circulator. If you want to be a signer, you can just come to one of our signing events, which are listed on the website. We have 2 right now. We're going to be adding more, and they'll be weekly. Each one of them is 1 day a week for the next 6 weeks. But if people would go to the Ohio Project and check the website, and we will have updates all the time on new signing places, new places to get training, and such.
What do you think the chances are of getting this through?
Oh, I think it's very good. Across Ohio, we've got volunteers that have been meeting for the last couple of weeks. We've got a network built all across. We've got a regional director in each one. I worked closely with him. Lucas County really is a key because the other parts of the state, we've got 3 big metropolitan areas which will be heavily Democratic, and you'll be hard to get enough names there. You have to go by the percentage of voters. Lucas County, even though we have a high percentage of Democrats, we have a better chance of getting our numbers here. And the way the numbers work out across the state, the number of counties we have to have and the percentages, Northwest Ohio is a very key part of the state. Okay. In fact, it may be the key part.
All right. Well, thank you, Dave White, for joining us. If you'd like to read more about the Ohio Project, theohioproject.com. That is tonight's Talk Back.